Hello everyone, welcome to The Beauty Matters with me, Len Hossein on ALB UK TV. Today we are doing something different in the studio, as you can see all. I'm joined by Dr. Philippe. Hello, Doctor.
Hi, Lynn. How are you?
Very well, thank you. I'm very excited as well.
Yes, I guess that.
Thank you so much for being with me today.
Pleasure.
Last time we talked about mesotherapy and different procedures,
Yes.
and today we are going to
Actually,
do it.
Yes, action.
Yeah,
Okay.
we're going to actions. So would you be able to tell me more about what we are going to do and why we are doing it?
Okay. So thank you for the invitation, first of all, but also thank you for asking me those questions. So the treatment and the procedures that I'm going to do to you, it's a very bespoke treatment, which is called BioNutriLift. The purpose of this treatment is a two-stage treatment. First of all, is to inject hyaluronic acid, or commonly used called filler, and also some biorevitalization solution that we're going to use. It's the one I'm going to use is the NCTF, which is one of the stronger to improve the skin quality, hydration, tonicity, glow, and radiance. So the BioNutriLift purpose, in fact, is to restore the loss of the fat we have in the skin, but also because a different vector that we're going to use on the face, we're going to create a force or a lifting effect.
Okay.
So we're going to have a lifting effect by improving the contouring of the face.
Yeah, so it's more, we do contouring in makeup to have the effect of what we are doing now through the procedure, which is we tend to light areas and darkness areas to get this effect through makeup, but now I'd be able to get it through this procedure.
Definitely. So this procedure is is a French procedure. It's definitely it's been worked with beauty artists, makeup artists, and I know you have you had a few top makeup artists in your shows, and they all know about projecting the light to give the useful look. And we have a lot of patients, female patients but male patients, who want to have a youthful look. So the aim is to project the light, but also to improve the skin quality. So we're going to have a quick effect, so effect now, but a long-lasting effect by activating, the cell production and the collagen production as well.
How long does it last, if we say?
So the treatment, it depends, what age we are dealing with, but the ideal protocol would be one session today, one session in 3 months' time, and then once every year. It's really to maintain.
Yeah.
But really, you will see the result is instant.
Okay, that's really interesting that you don't need to wait for whatever you put in the body to work. You will see the before and after kind of quickly.
Yes, so you have an instant effect, but next week it will be even better, and within a month the effect is going to be enhanced day by day.
If we said like safety, the side of it, is it a safer procedure, and can you tell me more about if there's any side effect for it?
Okay, so this is why it's very important that I'm using this filler. It's a Filmed French filler, because there is 40 years of history. It's not a recent filler. So regarding the safety, so us as a doctor, we have to be very, very strict about what we are using for our patient safety, but for our safety as well. So by using those range, we know that there is a history, it's safe, it's CE mark. And do you remember last time I did mention to you about the importance of to have CE injection, because a lot of products for mesotherapy, they say mesotherapy, but not for injection. So if we can zoom on the box, we have the CE mark. The CE mark gives us the guarantee that what we are using is safe for the skin, so safe for our patient and safe for us injectors.
Yeah, mesotherapy, we covered it last time, but if we can just remind the audience of why we do mesotherapy, why it's becoming big and trendy. Now everyone wants to do mesotherapy and kind of people getting addicted to it.
Yes, so mesotherapy is getting trendy, you're right. Mesotherapy is getting trendy for the patient clients, but also trendy for practitioners, because more and more practitioners, they see that there is a huge demand, so they want to have the mesotherapy.
Yeah.
But if you want to do the mesotherapy, you need to have the right training, the right ingredients, because you can have the right training, but if you have the wrong ingredients, is where the side effect can come.
Caused, yeah. And now today we are going to do the post of the procedures. Which one we will start with?
So we're going to start by doing the BioNutriLift. The BioNutriLift is going to be just one entry point on each side of the face, using a long, soft needle, which is not very painful. And I like to use the magic needle one because they adapt very easily to the pressure of the skin. So, and they are not painful at all, and they exactly provide the right length and size for patient more comfort, when we do the procedures.
Mesotherapy, is it just for face, or we can do it in other places? We talked about it in the last show, but also to remind people who are interested in mesotherapy, where we can do it.
So when we do the consent form, so obviously, yes, we did the consent form, because even in the procedures, the consent form has
which make me more safe.
Yes, yeah. Consent form has to be taken. We took some pictures as well. It is very important to remind you, auditors, that pictures need to be taken. So then when we've done the mesotherapy consent form, there is different indication. We have for alopecia, hair loss. We use for cellulite, for fat reduction. But also we use for face rejuvenation, neck rejuvenation, décolleté rejuvenation, and hand rejuvenation. So as you can see, there is so many indications with mesotherapy.
Yeah, and you mentioned hair. So is it like also as a facial one? It's like every 3 months, or how often you need to do it?
No, for hair is a bit different. So for hair, again, I'm using the NCTF 135HA, because when we have, a woman and a male patient coming to you, they are concerned about the hair. Why? Because, when you're dealing with, hair loss, it's more about, the hair becoming very dry, very thin, they break easily, they've got patches, where there is no hair. So there is really a big concern. So we're using the NCTF, which provide the right nutrient for the hair follicle for them to become stronger. But we have a special treatment which is combining botulinum toxin and the NCTF. And it's only 3 sessions, 1 session day 1, second session in 2-3 weeks maximum, and the third one in 3 weeks. And we repeat every 6 months. And we've got a huge success on the result, because the hair become firmer, stronger. When I asked my patient, they said, my hair, they feel more silky. So they're very soft when they touch them, but also coincidentally, they dry quicker. So what does it mean? That means that when you wash your hair, you don't have to blow dry your hair as long. So because you don't blow dry your hair as long, it's less damaging for the keratin.
Yeah.
So it's it's a vicious cycle. Because we have the treatment, the hair getting better, you don't dry as long, so you don't damage. So we have an effect, it's really like a snowball.
Yeah.
So the result is amazing.
I'm very looking forward now to try it myself, and we're going to show the audience step by step how it's happening and the final results, of course.
Correct, yes. Thank you very much.
Thank you. We'll move now.
So we remove the makeup, very important. Okay, antiseptic is not going to remove the makeup, so you need to use really a proper, eau micellaire from skin perfusion. Is really, it's one passage will clear it. So then you use an antiseptic, so you use or Clinicept or chlorhexidine according what you have available in your country or in your clinic. So Clinicept is quite very good. Then what I'm doing, I'm marking, the end point of my injection. So this is the marking. So then according to the magic needle cannula, I'm going to define what is going to be my entry point of my art filler. So my entry point is going to be in the zygomatic. So I'm going to draw one line, top the nasal fold, then middle of the nasal fold, and the final one really corner the lips. So for lean, I'm going to use, so we've got different type of filler we use for this typical treatment. We have the fine lines. Fine lines is where we want to have, you know, really a projection. But for lean, I want to use the universal. Why the universal? Because I want to have support, but also a bit of projection to have a good definition of making the contouring even more enhanced. So this is my injection point, and as you can see, between each line of filler, I'm going to inject my NCTF. So my NCTF, at the same depth than the filler, is going to spread nicely and is going to have an activation of the fibroblasts. So action on the production of the collagen, action on the elastin of the skin as well. So, and so it's going to be two-stage treatment. Okay. So I mark my entry point. Nice. Disaffection is paramount, as you can see. So to numb the entry point, I like to use lidocaine and epinephrine, xylocaine.
My audience probably first time they see me quiet. It's because there's something happening on my face, so I need to be quiet. How long normally this procedure take from start to finish? How long?
Well, you have to really, it depends, because when you have a patient who had it before, it takes 20 minutes. But when, I think it's very important to have, so we do one entry point. How was it? Did you feel something?
No.
So you have to explain to your patient what you're physically doing, because they deserve to understand, you know, really the whole procedures, and I think it's very important, because you need to put your patient at ease, and this is really, really the most important.
So now what did we do?
So we've done the entry point for our cannula, magic needle cannula, to be able to enter. So you prime. The advantage of this filler is we've got 1.2 ml. So what I'm going to do, I'm going to use 0.6 on each side. So it's more than 1 ml that we have in the normal syringes. So I'm going to have, you know, my entry point. I'm fine. And then I'm going to direct my cannula. How is it?
I don't feel it so far.
Okay. So then we look at the graduation. And I'm doing a small, I like to do a small bolus in the nasal fold. And retrograde slowly, slowly, slowly. And I'm pulling the skin because I want to create a lifting effect. So second line, where I'm going to inject again. And I can see that one bolus of 0.1 ml. And retrograde, while I'm pulling the skin, 1 ml, 0.1 ml.
Would I be able to speak?
Of course you can speak. Do you feel any pain? Is it unpleasant procedures?
I can feel a little bit, but it's not pain. I was just like, I think that's normal.
But you know, this is very interesting treatment as well for, you know, for someone who's got, you know, acne scar. Because what we do, we defibrose the skin, and we've got an amazing result for acne scar. So again, I'm doing a bolus, you know, of 0.1. As you can see, I'm pulling the skin because I want to have the lifting effect. So the filler universal has been injected. Now, between each line of my filler, I'm going to inject the biorevitalization solution. My biorevitalization solution is got 3 ml. I've got 3 ml in the vial. So I really need to dispatch properly. So it's going to be 1.5 on each side.
So how it will be like 2 times you're going to inject it?
Yes, so I'm going to inject, 1 ml on the first, mark and 0.5 between the 2 other lines. So I'm going to have 1.5 ml on this side and I'm going to have 1.5 ml on the other side.
Okay.
So let's go on this side. So, and I'm going to inject now. So I'm just defibrosing the skin because we're going to have a better, response from the treatment. So
I felt this more than the first one, but
yes.
it's not painful, but it's just like the feeling.
Yes, because I've done it on purpose because I wanted to defibrose the skin because I wanted to have a better response on the long run. So now one side is done. So I'm going to remove the mark. So like for the other side, so my entry point, and I'm going to draw a line, middle of the nasal fold and corner of the lips, and between is going to be the NCTF, okay? Just I remind the audience that the filler, art filler universal, we have 1.2 ml in total, so 0.6 on each side. So bolus. Is it right?
Yeah. I'm avoiding speaking.
So I have the bolus. This is really, I would say, a bespoke treatment because it adapts to every age, every skin type, and to have exactly, a natural effect. So this is the beauty of this treatment. And you can see I'm defibrosing the skin. So really, because we want to have the optimum effect within one session.
There's always a more sensitive side of the face.
Of course, one side is always more sensitive than the other one.
Yeah, and so I feel this side is more sensitive.
Which one? The left side, yes. I guess it's going to be the right one for the audience. So, and now I injected a filler. I'm injecting again the NCTF, okay, so the biorevitalization solution. I remind you the NCTF purpose is to improve the skin quality, hydration, tonicity, glow and radiance. And bear in mind, because we live, in polluted area, okay, otherwise when you live abroad in the Middle East, the, humidity, so it's very helpful to restore skin quality, hydration, tonicity, glow and radiance.
Yeah. Well, I personally have kind of quite dry skin, so hopefully this will help.
So you will see definitely you will have enhancement in your skin. How do you feel? Okay?
Yeah, I'm good. All good.
So far so good. How is this side now?
This side's better now. I can't feel it, but yeah.
So now we're going to do what we call the mesotherapy injection. The purpose of the mesotherapy is to inject all over the face, you know, a cocktail of vitamins. The cocktail of vitamins, it's not only vitamins. We've got actually, as you can see in the NCTF 135HA, we have exactly, we have 12 vitamins, vitamin A, all the collection of vitamin B, vitamin C as well. We've got mineral elements. We've got 24 amino acids, which is quite massive. We've got nucleic acid. We've got coenzyme. What does it mean? It's a whole collection of ingredients. Each one's got a specific role for the skin. And in fact, and also they provide some energy for the fibroblasts to be active. Fibroblasts, yes, to produce your own collagen. And the advantage for us is the box has got everything inside. We've got one vial of 3 ml of the biorevitalization solution, the drawing needle, the injecting needle, the syringes. We've got as well, what is very important for the traceability of the products, we've got a batch, as you can see. This batch, it's, if there is any issue, we need, if you want to look, Lynn, this is what we stick on the patient, you know, consent form, so we know exactly what has been injected.
What used, yeah.
Yes, and what the day. But that's very, for us, it's very important. Traceability of the products and safety of a patient is really, like I said, is paramount when we do aesthetic procedures. So now, let's do one thing. So first of all, yes, go ahead.
So now we are doing, we are injecting with vitamins and mineral.
Yes.
Do you go deep or is it very?
This is, I'm going to leave, you know, to you to decide. So I've done already one disinfection of the skin. I'm going to do a final disinfection and I'm going to tell you not to touch your face, okay? This is very important. Do not touch your face, please.
Okay.
So when we do training, we always mention it takes 2 minutes to disinfect the face, 2 weeks to treat an infection. So, you know, we have to be on the safe side. So this is very, you know. So disinfection has been done. I'm going to do a third one. And very important, again, please do not touch your face. So the mesotherapy is a typical French technique dated from 1952. Okay, so it's his purpose is to inject, you know, a small quantity in the right place, you know, definitely small in the right place, and definitely in, you know, at a specific time. There's no point to inject a lot of quantity of products because we're not going to have, you know, a better effect. So let's start by the first technique. The first technique, it's very important, Lynn, because we live in a multicultural society. So we have to have the bevel of the needle up. Because when we're dealing with a Caucasian skin, we're going to have, you know, a scratching of the skin. So what does it mean, scratching of the skin? We're going to have like a hypochromia. So we're going to have white dots. So white on white is not a problem. But when we're doing this treatment on ethnic skin, you know, dark skin and white dot is not going to be really very pleasant for a patient. So to be safe for each one, we keep the bevel up so that we're not going to have any problem. Okay? So the first technique is what we call the epidermic technique. The epidermic technique is quite a pleasant technique because in the epidermis we've got quite a few cells where we need to activate them. Okay? So you just let your head, I'm going to control with my hand. So I'm going to put my needle and I'm just scratching the skin. I'm guessing you have the impression I'm not doing anything. Am I correct?
I can't really feel it, but I can feel your...
I'm slicing your face like a pizza, yes?
Yeah. Yeah.
So the outcome is going to be like you're going to have, you know, if I'm pressing a bit more, it's like if you had, you know, a cat scratch on your face. But normally it shouldn't be really.
It doesn't leave any mark, doctor.
No, it doesn't. Don't worry about that. So this is the first technique that we're doing on all the face, okay? Obviously, if you have someone with acne, active acne we would not recommend, but someone with acne spot, we can still doing it, and just to avoid, you know, the acne. So don't forget the nose. This is very effective for, you know, the pores. How many patients comes to us and said, well, what do you have treatment for the pores? This treatment is very effective. How are you feeling, okay?
Yeah, trying not to move.
Do you feel anything or not? Do you feel unpleasant?
I just feel the needle, but it's not as bad as I expected.
Okay, don't touch your face, please. So the first technique is done. So the second technique is going to be what we call the papilla. The papilla is the junction dermoepidermic for the fine lines, but not only for the fine lines. It's very effective for dark circles, but also for those, you know, fine lines you've got just on the, you know, lower eyelid. That is very difficult to get rid of them. So we've got, you know, a new needles called NanoSoft, and that one.
Is it the same material we're still using, like the same minerals?
Yeah, exactly the same. We're just changing the needle.
Okay.
So you don't have to worry about the material. I'm not changing anything. It's just we're changing the needle.
To show the different,
Technique.
the second technique, yeah.
Yes. So that one, it's for the fine lines and.
Yeah, so far it's the one which hurt a bit.
More than the previous one, yes? Unpleasant?
It's just a bit, it hurt a bit, yeah.
How much on a scale to 1 to 10 would you say?
I would say 3.
3? Okay.
Like I felt it more.
Yeah. But this is, you know, very effective for dark circles and the fine lines.
I definitely have my left side most sensitive.
So now you know.
Yeah.
So you know.
Is there anything coming to my eyes?
How? Which one? The right or left?
Left.
The corner or here?
It just feels like this. Yeah. Yeah.
Better? Okay. So what we do as well, we can do on the chin. And on the nasal fold, the line between the Okay, how was it?
No, it's here I didn't really feel it. It just around the eyes was more sensitive. I'm trying not to touch my face as you said.
Yes, don't, but I will disinfect anyway. And then we're going to the third technique, because there is 3 techniques in the mesotherapy injection. So I like to put my finger on the chin and to see where we've got, you know, the break of the oval. So that one, I'm just going to ask you to turn. So what we've done the mesoglow, and now we're going to do the mesolift. Okay? So I'm pinching. How was it?
Yeah, it was okay. So is that more a contouring?
Yeah, no, it's just to reboost, you know, the oval of your face. So at least we're going to have, you know, a nice, you know, lifting. So we're going to have a lift here with the BioNutriLift, and we have a lifting on the lower, you know, lower jaw with the mesotherapy. So do not touch your face, please.
Okay.
Again, very important not to touch your face. And I guarantee you that you're going to see, you know, for the fine line under your eyes and the dark circles. I'm not saying you have dark circles, but for our patients, it's amazing treatment. It's amazing treatment. And then the rest of my cocktail, if there is, I'm going to rub everywhere. And what I like to finish my treatment, I like to finish my treatment with a nice, you know, vitamin C cream, and that one is my favorite. And all my patients, they love, because they love the smell, but also the action. Is from SVR, Laboratoire SVR, is a French laboratory. Densicium is a B serum. What does it mean? It's, you know, one which is serum hyaluronic acid, and one with vitamin C, and they are separated. They only mixed when you use single use, because if you use the vitamin C straight away, you know, it's very unstable. So it only mixes when we press. And then I'm going to inject.
Final touch.
Yes, the French touch, the French touch.
Yeah, it is a French touch.
And obviously, because of the time is fine, but never forget that the final touch should be, you know, SPF. After every procedures, aesthetic procedures, should be to apply SPF. And everything is done.
Thank you so much. I can't wait to see the results.
Thank you as well. Thank you to you. So can you tell me, can you tell us how you're feeling about the treatment itself? Unpleasant, you know?
No, it's not painful at all. It's, I expected the worst, to be honest, before we start. I didn't feel most of most of the procedure.
Yes.
But I definitely have, like, I be more sensitive to one side of my face as everyone else in the world in comparison to the other one. I didn't see it yet, but I didn't feel I have anything done. Like, there's no kind of burning or pain or anything on my face. So I'm just looking forward to see the results now.
I know, and I'm sure that in 3 months' time I'm going to receive a phone call from you saying, Philippe, I'm due for my second treatment.
Thank you so much. And you definitely have amazing magical hands, because I didn't feel it. I'm not a good patient. I complain a lot. So thank you so much, doctor.
Pleasure. Thank you so much to you. Thank you.